I want to introduce Paul Klain. He is the president of our local chapter and been involved in the creation and development of our health IT program here at Johnson County since the inception, and just really appreciate all the support that he has and the vision that he has, knowing and understanding the pipeline and the connections, how he works with internships and tries to help us develop those. So that's why, and specifically, I asked Paul if he could share his thoughts and help us make that bridge between the education, the experiences, and the getting into the jobs in the industry. So, Paul?
All right, thank you. Can everybody hear me okay? If I turn to the right, can you still hear me? Turn to the left? Oh, the left is better, okay. How's the profile with the camera? Okay, great. Okay, well, again, thank you. Introduced myself earlier as the local chapter president. So I'm going to also wear two other hats today. I am also the Chief Information Officer for Liberty Hospital. So I am responsible for all the IT services, telecom services, and basically anything that has a plug and a ground in it, I'm responsible for, and the staff to support it. Additionally, I am the AVP for Allscripts Managed IT Services in this region. And our region is really big. We have one client, Liberty Hospital. So it is growing, and we'll talk a little bit about some of those opportunities a little bit later, or you can come up afterwards if you'd like to talk to me about that if you're looking for employment or want to learn more about Liberty Hospital and Allscripts. I'll make myself available. But I'm sure everybody is here for something, got something else on their mind that's not really IT right now. So I don't know if you guys noticed, this is a picture from the Friday night game and the LCS championship game with the Angels in Los Angeles. And man, there's an awful lot of blue people standing up there really, really happy. And a very excited team. And a lot of the things that I do within my organization, I like to relate to teams. So whether it's a football team or it's a baseball team or whatever. I play baseball as well, so it kind of just makes it easier for me to relate to that. But anybody notice the guy in red up here that's really looking away from the home run and got this really disgusted look on his face? You know, it's kind of what sometimes we can get into in healthcare. Things will happen all around us, people will get excited about stuff, but sometimes it's not exciting to everybody what's going on. And as a CIO, we have to be aware of that. And we can't be so overly excited that we disconnect from our healthcare partners, from our employees and others. So today's presentation really for me is from the perspective of a CIO, okay? So we'll talk a little bit about what things I look for when I'm doing recruiting and the type of people that I like to bring onto my team, those that are energetic, maybe young, maybe not. But they definitely want to be energetic to be a part of my team because there's a lot of work to do. I don't have the clicker because I was putting this presentation together while we were sitting back here, so I'm actually just going to hit the page down and walk through this. So today's objectives, I'm going to tell you a little bit about Liberty Hospital and Allscripts Managed IT Services relationship. I'm going to define the pipeline for you, what it really means when we say pipeline in the context of healthcare IT and partnering with Johnson County Community College and others in bringing employees into our organization. Why busy healthcare IT leaders must invest time and energy into the pipeline. We are all very, very busy. We have more work than we know what to do with. And it is difficult to get it all done in an 8-hour day. In fact, it's impossible to get it all done in an 8-hour day. However, we have to invest time into the pipeline. So I use this analogy a lot, so I want you guys to think about this a little bit. And maybe for those of you, especially in the HIMSS local chapter, that have heard of this before, bear with me. Everybody's heard of Colonel Custer, right? You know, the guy that really had a really bad outcome on Little Bighorn? Yeah. So there's this little story that a mentor of mine told me a long time ago before I got into management. He said there really was a vendor or a salesman that visited with Colonel Custard at Little Bighorn, and he kept pestering him while he was fighting. And then last thing he said, I'm sure, Colonel Custard, what I have for you, I understand your problem with all the Indians here. We can solve that problem for you if you'll just give us a little time. And then Colonel Custard said, sorry, I'm too busy fighting Indians. And we all know what ended up happening to Colonel Custard. So the point of the story is, even though we are busy people, you have to take time to invest in solutions and looking at things where people can help you out. And this is part of why the pipeline is so important to me. I'm also going to tell you how I use the pipeline in my search for talent, and how you can enter into the pipeline if you aren't already. Liberty Hospital. It's a small, public, standalone community hospital. It is part of, if you not familiar with Liberty, Liberty's actually has a hospital district, and what a hospital district is, it's a taxing entity that's been set up, and there's a publicly elected board, and that's who governs the hospital. These folks and these individuals could be the owner of the local gas station, or it could be a housewife down the street. It's anybody who lives in the area can apply for and become a member, or not apply for, excuse me, can campaign to be a member of the elected board of directors for the hospital. So as you can imagine, their experience and understanding with the healthcare system is quite wide and varied. Liberty Hospital is standalone, as I mentioned. It is fiercely independent. People talk about someday Liberty Hospital might be gobbled up by, big O HCA, who I used to work with, and that rumor is out there. It's always out there. But let me tell you, it ain't gonna happen. You have a publicly elected board of directors. They want to stay independent. So this is a very challenging environment for us as a standalone hospital, a non-for-profit institution, in that our resources are very, very constrained and all within our own organization. We have 228 licensed beds. That's actually downsized from what we originally were licensed at 250. That was in July of this year that actually formally happened. It's actually somewhat of reflective of what's happening in the industry and a consolidation and a glut of inpatient beds out there. Healthcare reform and population health management is all about keeping everybody out of our institution. That's where the expensive care comes from. We have more than 330 local physicians. 40 of those physicians are employed by the hospital district itself, the Liberty Clinic and its clinics at Excelsior Springs and Kearney. And the rest of the physicians in our hospital that practice are either private practice, trying to stay solo, or they're already employed by another group or part of a consortium in the area. We have 1,400 employees and 30 IT staff. So prior to Liberty Hospital, I was the CIO of the Midwest Division here in Kansas City. I had 10 hospitals underneath me. We had 100 staff managing 10 facilities, and if you average that out, that's about 10 employees per facility. Okay. Well, you got to see there's a little economies of scale there when you're managing a district and being able to several hospitals and being able to use the same resources and knowledge across multiple hospitals and to be able to shift resources around. Liberty Hospital does not have that opportunity. That's why we have 30 IT staff managing everything. Here are the mounting challenges out there in the industry, and I tell you these things because to understand the pipeline, you have to understand the challenges of the people who you may be wanting to be employed with in the future. Hospital admissions are going down. Payer rates are going down. There's the pressure from the federal government under the Spending Reductions Act that happened. Insurance providers are being crunched and they're negotiating tougher on rates. More people are ending up with self-pay, or they've gone to Obamacare and those particular types of health information or health insurance exchanges that are available out there. And there's increased regulatory claims audits and denials. In fact, I think CMS's strategy is to deny, and we'll postpone payment as long as we possibly can, and I'll make interest off the money. You know, that's actually kind of a strategy that businesses take sometimes. But what's just a kind of a side note there, it's about 68% of the denials that happen in our hospital actually get turned back over and are actually good, and they end up paying them. The problem is that's usually 3 years later after the audit process and all of that. So again, more of these challenges that the hospitals, especially a small community hospital, has to deal with. At the same time, all of our revenue is going down, our costs are increasing, thus our margins are going down. So we're burning the candles at both ends at hospitals, especially community hospitals. Healthcare IT, as you guys all know, is very expensive because people like you that work in this industry, we have some pretty high salaries relative to everything else because of the high demand and shortage of people in our industry, and those that are knowledgeable and experienced. Suppliers and equipment continue to go up, even faster than what the common inflation rate is. Human capital, malpractice, and other insurances, those continue to climb. And then also legal and regulatory compliance. There's more need for legal to get involved with a lot of the agreements and the interactions that the hospitals have, either with negotiating with physicians or with the federal government. So overhead continues to climb. So this is a really bad situation for hospitals in our country right now. So you have to understand why, when an employer CIO is looking for healthcare IT people, we can't just, as Mary Beth was saying earlier, put people in seats. We have to hire people who are qualified, skilled, motivated, and can hit the door running and being efficient and productive. Because it's an expensive resource, people, and we have to be efficient with it. So let me tell you a little bit about the other major challenge that Liberty Hospital had in May of 2013. Because of all these pressures, Liberty Hospital was losing about $1 million a month. Well, they're non-for-profit, but that doesn't mean they got to go broke. They got to at least break even. And because of the reductions in the volumes, the increases in costs, the reduction in how much CMS was paying per click or per case, episodic care, Liberty Hospital's board recognized that we can't continue to lose $1 million a month and still be able to support the community. So we had to eliminate 129 positions out there. That was nurses, that was transporters, that was lab techs, radiology techs, across the board. There was only one department that did not reduce any staff, and that was IT. In fact, IT investments have gone up because Liberty Hospital, for the longest time, thought that they could just sit in their little bubble and operate as a community hospital, and all this stuff that's going on all around them doesn't impact them. It absolutely does. So they got smart and decided if we're going to keep the IT, we got to be more efficient with them. We believe we can make this happen. Sorry, I'm a Royals fan. And we partnered Allscripts, our EMR provider. The EMR providers out there are trying to learn how to also survive in this new environment, because net new sales for EMRs is pretty darn low right now. We've already saturated the some odd 6,000 hospitals and clinics that are out there. There's not any net new sales. And once you get a system into place that has cost you well over $1 million, as an example, you're not likely to forklift it and change out on that system. So EMR vendors are trying to figure out how to survive in this new world. And so they're expanding their services. So Allscripts is, originally we were just a top-tier client of hospital EMR systems and clinical ambulatory systems. We had a worldwide client base. We had Most of our clients were on the East Coast and the West Coast, not a whole lot here in the central U.S. The headquarters was in Chicago, and they were in acquisition mode, so lots of EMR vendors were buying other EMR vendors. You know, Allscripts purchased Eclipsys and other systems that were out there. But we're growing in Kansas City. Our CEO, Paul Black's been there now for 2 years. Actually was formerly, I believe, the COO at Cerner Corporation for several years. And so this is still his hometown. He still lives in this area. Additionally, just last June, we opened up a data center in Raytown. So all of our Allscripts Corporation's operations, enterprise applications, our payroll, our HR systems, all those things are actually now housed here in Kansas City, and I bet many people don't realize that. Eventually, the applications services will also be housed here in the Kansas City area, one of 3 or 4 data centers that we have across the U.S. So we've evolved and expanded to also provide population health management solutions, managed IT services, which is where I work, and remote hosting services where the equipment, or the cloud if you want to call it, is actually out someplace. And we also have expanded our professional services offerings out there, both globally, out of Pune, India, as well as in the, in the U.S. So our partnership began after those layoffs. In August of 2013, the board said, we've got to figure out a better way to do this, and we've got to get into the game as quickly as possible. So Allscripts offered up to Liberty Hospital, well, let me do more than just be your licenses and support. Let me go ahead and manage all of your IT services, and we can do it more efficiently. So what part of that, the benefits to the hospital were lowering the EMR licensing and maintenance costs. We immediately relieved Liberty Hospital of any of the AR and the HR, the benefits and the recruiting responsibilities of that IT workforce so that they could focus on hiring nurses and not IT. And it immediately expanded the bench. We will go from 30 employees, many of which have been there for 20 or 30 years, to an international company with a lot of experience and understanding about not only their software, Allscripts, Sunrise Clinical Manager, but all the array of applications and companies that they work with. It also expanded, and I'll talk more about the definition of the pipeline. No longer did I have to try to hire somebody who was just within Liberty, because that's where my friends were, and that's what I wanted to stay, was nothing but Liberty. It expanded it to being more national and somewhat international. It also gave the hospital leverage. Gave them insight and influence directly into product support for Allscripts products, as well as helping in the development and enhancement of those products. The trade-offs, obviously there's going to be some. Liberty Hospital gave up some of that autonomy for IT support services. And what I mean by that is, and probably all of y'all have been in an IT shop at one time has probably experienced this, is when somebody comes up in your organization and knocks on the door and says, I need some help with this right now, it's the most important thing to me, we usually got up out of our chair, ran over there and took care of it. Could have been a printer jam. You know, could have been something simple. What this does is it actually brings in ISO industry standards around service desk, around how we prioritize and have service level agreements. All of that stuff that Liberty Hospital could not focus on in their standalone environment. It brought that to them. So there's some benefits, but the trade-off is you gotta work within the rules of how you do those kinds of things. And then I have to manage some perceived conflicts of interest. So I am employed by Allscripts. But I am also the CIO for Liberty Hospital. So when a department comes up and asks for assistance in a new product line or wants to do a demo, all of a sudden, first thing that comes to mind is, well, I wonder if Allscripts has got some products for that, because I have a vested interest in the success of Allscripts because I'm employed by them. But at the same time, I cannot exclude other solutions that might be out there. So that is, that is a really, really interesting situation. It's the first time I've ever been in this type of a situation where I have to manage those expectations and those conflicts of interest and the community perception that we are going to be run by Allscripts and Extentia. So again, this is Liberty Hospital. This is who we are. So let's talk about the pipeline a little bit. All right, so I had to go and pull out a formal definition from dictionary.com. I would have looked up Webster's, but dictionary.com was easier. But again, it just puts it in context of how I look at what the pipeline is. A long tubular conduit or series of pipes. So it's not just one. A pipeline is actually a collection of pipes and feeding into it, some bigger, some smaller, and those kinds of things. And it's really all about channeling or the flow of supply, the human capital, people. There's always going to be a flow of people into and out of your organization. So those in the room who are managers, if you don't understand that concept, you are doomed to fail. If you think you can keep your A team as an A team forever, you will fail. You have to plan for, you have to understand that there are people who are going to develop, there's things that are going to happen in their lives, and they're going to leave your organization for one reason or another. So you always have to continue to feed the animal, if you will, and to keep that organism or that organization alive. So, I go too far? Okay, sorry about that. The pipeline, the supply, I view them as the high quality health information technology employment candidates. That's my supply, that's what I want. If you were thinking as an analogy of water and oil in a pipeline, that's not a good thing. I don't want water in my oil as it's in that pipeline. I want high quality crude, light, sweet, American Texas, West Texas crude. That's what I want. Because it's efficient, you can manufacture it and refine it very quickly and very easily, and it's expensive, but it certainly gets the job done. So when we talk about the pipeline, I have to think about it in terms of I am looking for a set of quality people. And these are the things that I'm looking for when I'm looking to fill a position. Person has to be educated. That doesn't mean they have to have a master's degree. It doesn't mean they have to have a doctorate's degree. It just means they need to understand and be educated in the skills that they are necessary for that job, and they have to understand our industry. Trained. They have to have been trained specifically on something, hands-on training. Not somebody who's just read everything in a book and done things on a whiteboard. I need people who have been physically trained to do some things. They need to be proficient at it. I'm not looking for people who are C players, if you will. I am looking for not double A, not triple A ball players. I am looking for major league ball players to join my team. They have to have good soft skills. So good soft skills, and Deb knows that I stress this a lot with our high-tech program, and it's difficult to train this. Good soft skills are, do you know how to relate to people? Do you know how to understand what their needs are? Do you understand what they're dealing with? What are their challenges? And then you can take the information you know and figure out how to help them with it in a way that it's symbiotic. Not, I'm going to tell you this is how you fix your problem, but you guys work together and you develop those relationships, if you will. Soft skills are really, really important, and I bring those out a lot in the questions that I ask through the interview process. You have to be eager to work hard. This is a challenge for the Generation Y with the Generation X that I'm in. Not that they won't work hard for 8 to 5, but will they work hard for 8 to 5 and then the upgrade you have to do at 1 a.m. in the morning the next day? Because a lot of the younger folks are much more about work-life balance. And I completely agree with that. We need to balance our work life and our life at home. So we'll be well-rounded people. The challenge for the manager is to recognize when it's getting out of balance and take care of that. But you have to be willing to work hard, eager to learn and develop, and most of all, you have to be a good fit for the organization. And that is really around culture. Some organizations, okay, so I've been in the for-profit world with HCA, and I'm now in the non-for-profit world with Liberty Hospital. Some organizations are very focused on efficiency, numbers, and checking boxes. Other organizations are more about the relationships. So in the current hospital I'm working at, it's a lot about the relationships. So no matter how technically proficient you may be and really efficient in getting your job done, if you can't relate to the people in the organization, they don't care. They really don't care. You have to be a good fit for that organization. That doesn't mean you're wrong or that you're not a good person or a good employee. It's just you have to fit within the culture of that organization, or in our case, a changing culture. Sometimes culture is change. The pipes, the flow of your supply. I've kind of prioritized these by the quality or basically the effectiveness of the people that I get when I look at these things. So my existing employees, I think Mary Beth mentioned this a while ago, those are your best. Because if you've established a culture and you've built those relationships with your staff, they know what kind of people are going to work well with you in that organization. And they're going to be your best recruiters. On the other hand, if you're having trouble with your staff and your relationships, they can also be your best detractors. They can keep people away. You don't want that to happen. Volunteers. So in this context, I'm talking about volunteers at the hospital. I have had my best employees come from people who weren't even in IT. They were volunteering at the hospital. They were taking flowers upstairs. They were pushing patients around. These types of people that volunteer have a special gift about wanting to help people. They really get into this fit of an organization or fit within healthcare. We can train technical. You can send people to school to learn the technical. But the soft skills and how you interact with people and understanding what the healthcare organization is about, how patients flow through the organization, what they feel like when they're in the room not feeling really good that day or scared. You know, I always have to remind people in IT who have never been in healthcare before and they come into healthcare. People come to a hospital, 99% of the people that come to a hospital don't want to be there. So they're not going to be in the best frame of mind. Now, the one area that is a lot of fun to work in, and where people are usually pretty darn happy, is the obstetrics and birthing centers. Those are really uplifting places. So if you do work in a hospital and you want to lift, just go walk down the hallway and go talk to some nurses who just gave birth, or look inside the nursery and see all the new births that are going on. You'll run into a lot of smiles, and it'll help cheer you up for that day. Professional networking. There are several different ways you can do that. HIMSS, your local chapter, or HIMSS nationally. AHIMA. AHIMA is the medical records equivalent to IT in a professional services organization, and they tend to cross paths an awful lot. CHIME, if you are, I would call it up the ladder, or been doing healthcare for a long time and you're trying to even move even higher or laterally somewhere else in the country, CHIME is a great place to go. And other professional associations that might be related. Radiology tech associations, they do a lot of, PACS is technical. Lab, they have associations. Any of these associations that are somehow tied to healthcare and you have an interest in those areas, those are great places to chat with people and understand what's going on in the industry. Social media, LinkedIn was mentioned earlier by Mary Beth. It is a great place. We have, for our local chapter, we have a discussion group out there, and I frequently look at what's going on, what people are posting, look at people's questions and what they're doing. And you know what? What great exposure to the other people who are looking out there as well, because you know, half the time when I see somebody comment out there, I'll click on their profile to see who they are, what they're about, what experiences that they had. Even though I may not even be recruiting at that time, it's a place to go look and find out about people. HIStalk. Is everybody familiar with HIStalk is? One? Our HIMSS person? It's not actually HIMSS based. HIStalk is a anonymous individual in a healthcare system someplace who started up this little service of collecting all of the industry news that goes on out there. And he was, at first, he used to start this and put it out there as a daily digest for just the news clips that were happening out there. You know what's happening now is people from the industry are sending stuff to him. So you learn about acquisitions and mergers before they even hit the paper. Or nobody reads the paper anymore, but they actually, out on the websites. You learn about people who are moving from one job to another job. You learn about changes in cultures happening in a company. You learn about which companies are struggling and which ones are succeeding. So HIStalk, they actually have a couple of other threads in HIStalk. One is specifically to physicians, one is specific to hospitals, one is specific to vendors. But it's a great place if you really want to see what the scuttlebutt is going on out there. And you know, more times than not, that information that's out there becomes verified and true within, you know, a week to 10 days. Blogs, it was mentioned earlier, Mary Beth mentioned about John Hamilka. He's a CIO that's got a blog out there that talks about the healthcare industry, what's happening. He's really got a great handle from a physician and CIO standpoint of what is happening in the industry and how it's changing. Recruiters. This one is a sticky wicket. There are a lot of recruiting companies out there. Some of them are even members of our local HIMSS chapter. And they do have a place. They help you find people if you're not able to find them. But the best thing to do, there are so many of them out there, if you're going to work with a recruiter, pick 2 or 3 at most, at least for yourself. If you're going to get on a recruiter's list as a candidate that you're looking for, 2 or 3. Anything beyond that, it tends to get a little bit too much to manage yourself. And they tend to network anyway, so they'll actually put their feelers out to each other. If you're a manager using recruiters, that's an expensive way to go. I do use recruiters very rarely, and usually it's for a very specific reason. Has to be somebody I got to get in there right away, and I usually bring them on as contract to hire. Really what that means is kind of a try before you buy. And I do that because I haven't had the opportunity yet to really get to know that person, to know if it's somebody, if it is that really high quality person yet. So all that risk is on the recruiter at that point. And then if that person doesn't work out, I don't have to go through all the HR stuff of removing that person. I can just simply call up the recruiter and say, find me another one. So some flexibility there, but it is kind of a double-edged sword. Sometimes it takes a lot of effort to manage that. Educational institutions and internships, and the advisory boards, you know, we have this relationship here with Johnson County Community College. We are starting our internships. I don't know yet how valuable they're going to be. That may bump up my priority list a little bit. We're going to see how that goes. But in those internships, because of the labor laws, they have to be very focused and defined. I can't bring interns in and have them doing tasks that I would normally hire somebody for. They may be tasks that are just for a particular project, a short-term duration, or something along. So it usually has to be very focused. But those folks is usually, again, some more of that try before you buy opportunity for me as a CIO. And then lastly, advertisements. I can't remember the last time I looked at a newspaper or magazine with job postings out there. But there are websites. It's kind of all transitioned to websites. LinkedIn, in addition to what HIMSS has for the job mine, LinkedIn has something similar out there. Monster.com, Indeed, those guys are kind of more generic and across the board, but they do have healthcare specific lines that you can apply for or see jobs of, healthcareers.com, et cetera. There's lots of them out there. And then again, lastly, magazines and newspapers are probably the least productive method of getting quality people into the pipeline. I think I've kind of already addressed this quite a bit, but why there is this need for the pipeline for a CIO, again, it's a continual flow. We have terminations, they're voluntary or involuntary. Involuntary, I need to reduce that as much as I possibly can because that takes a lot of work on my part to deal with the involuntary terminations, you know, somebody who's a sub-performer along those lines. So I choose to take all of my time and invest it on the front end in the pipeline, making sure I've got good quality people that I know are going to be successful. You'll have retirements, as we talked about the ages of people currently in healthcare. There's going to be retirements. People are promoted within the organization, so again, just moving along the pipeline. There are some leaks in my pipe. Sometimes we have dissatisfied employees for one reason or another. Could be pay, but if you know anything about HR, management, and personnel, usually the #1 complaint is their manager. They didn't get along with their manager. Pay is usually second or third. So again, I'll talk to that a little bit more specifically how I deal with that particular leak. Some of them are uncontrollable. A spouse has a new job someplace else and the family moves and you lose a member of your team. This is, you know, I'm not intending to be discriminatory, but this usually happens to my female workforce. Most of the time it's a husband who's leaving, he's taking an RN with him someplace. That's just kind of the reality of our industry. And then there is some industry poaching that goes on. I try not to participate in that. I try to build relationships with other organizations in looking for quality people who are moving up within their organization and are good people, but they just don't have places for them. So I tend to work with them and also contact them directly about letting them know what positions I have available. And if you got anybody on your team that might be interested, let me know. I don't try to participate in the poaching part of this. It's happened to me sometimes when other organizations come in and they know we've got really good people. And again, it's short. It's hard to find good people in the IT industry. And they'll just offer them things that a little old community hospital can't afford. There's just no way. We can't match the offers. The pipeline isn't static. There's bigger pipes, smaller pipes, more pipes added in all the time that require more project work, more systems, upgrades and conversions. New businesses, we're opening up an urgent care clinic, new acquisitions and partnerships with other clinics, those kinds of things. So it's always changing. So again, this is why we need to keep that pipeline healthy with staff coming in. And this is how I use the pipeline. It kind of goes back to the earlier slide. I just put some specifics. I'm sorry, I forgot what your name was. Yes, ma'am. Sherry. You were looking for specifics. So in blue, I kind of put some specifics out there for both the manager and for people who are looking for positions to manage that flow of the supply. Your existing employees, remember that's the one that's most important to me. I like to get to know my employees, understand their aspirations, their challenges, their backgrounds, and I like to make it personal. Not going over to their house for dinner, but I like to know what's going on in their lives. You know, does their family member have a health care issue that they're dealing with? Are they also have maybe a family member living with them outside of the traditional family? Those kinds of things just make it personal. Also helps me to remember their names, what their aspirations were. You know, the brain is actually kind of wired that way. The more connections you make with a face or people, the more connections, it's easier for you to remember the person as a whole. Help them achieve their personal and professional goals. Share with them your own experiences. That's probably the bigger thing. Your own experiences, not just your successes, your failures, what you've learned. That's probably one of That last one has probably been one of the biggest learning things for me over the last 5 years, is not so much sharing your accomplishments, but what did you fail at and what did you learn from that? That vulnerability helps to build those relationships with your staff. Professional networking, where people who are looking for positions and jobs join and actively participate. It's not good enough just to join an organization and have your name on a list. You got to get visible. You got to actively participate. Our local chapter has a programming committee. We're always looking for help on people to do the name badges, to get mailing lists out, to help us with the marketing materials. I mean, this is a volunteer organization. We all have very busy jobs and limited time. The more people we can get to volunteer, the easier it becomes for the greater good of the organization, but the individual gets all that exposure to all these different people. Social media, LinkedIn, HisTalk, and blogs. Dedicate some time, both managers and people who are seeking jobs, dedicate time specifically to explore these kinds of resources. Review information. I review information about my staff and what's out there. That's how I get to know about them personally. Some people call it stalking. It's really not about stalking. It's just getting to know somebody. If I got an applicant, before I even call the applicant, the first thing I do is a Google search on their name, and I start looking around to see, okay, where have they been working? Have they been published? What have they done? Sometimes some not so good things come up that aren't on the job application and you should know about. Recruiters, I talked about this earlier, establishing that trusted relationship. But when you establish that relationship, how am I doing on time, Deb? Am I doing okay on time? Yeah. 5 minutes? Okay. Clearly articulate and hold your recruiters accountable to your organizational's culture and the expectations of the people you're looking for. If your recruiter is just bringing you a whole bunch of people just to give you a whole bunch and say they're really busy, that's not a recruiter you want to work with. You want a recruiter that can target and understands your business and your industry. Educational institutions, we've started up this internship program. When did they start? Monday, I believe? They're going to be working with us on our patient portal. And literally what these students are going to do is they're just going to go around to patients' rooms and say, hey, did you know this hospital has a patient portal? Can I show you how it works? And get them recruited and actually logged in and using it. For the hospital's benefit, that's a requirement under meaningful use that we have at least 5% of our patients actually log in and use the portal. You wouldn't believe how hard it is to reach a 5% threshold. Most people don't want to give you an email address because they think you're going to market or do something with it. I participate on several advisory boards at different schools, including Johnson County Community College. And then the last thing, I didn't even put anything that I do there because I don't these days under the advertisements area. So how can you get into the pipeline if you haven't already? Get uncomfortable. If you are comfortable or in your habits right now doing the same thing over and over again and you're not getting different results or not getting the results you expect, you got to get uncomfortable. In healthcare, you will be successful if you learn how to get uncomfortable because things change. They constantly change. I'm probably butchering the quote, but I think it was Einstein's definition of insanity. Continuing to do the same thing, expecting different results. Insanity. That's all you're going to get. You got to change. Diversify yourself. Join and get involved with multiple new organizations. Learn more than one system. Do we still have any COBOL programmers out there who are being successful just in the COBOL world? We have COBOL? Really? Cool. You've learned a few languages since then, I think. But for the longest time, just in that specific example, COBOL programming, to get that resource got more and more and more and more expensive because there was fewer and fewer and fewer people that were still able to even do it. But the more you diversify yourself, the more marketable you become, the more options you have. Learn more than one system. Get involved with and join multiple organizations. HIMSS is great, that's one, but don't let that be your only one. Invest in yourself. We talk about a lot of formal education here. Volunteering, again, that's a way. And probably one of the bigger things for me personally, that's a turnoff when I'm talking to applicants, is a lot of them aren't humble. Especially generationally, that seems that way. Find a mentor, because you don't know it all. Even though you've gone to a lot of schooling, find a mentor because you're going to get different perspectives of what's going on. And ask more questions rather than direct marketing yourself. People will learn more about you by the questions you ask than what you tell them. So, I believe that's it, and my time is probably up. Those were our objectives. Hopefully I've covered them all. And this guy here, I just want to make sure, yeah, oh, that was my, he borrowed my number 5 one time. But go Royals. Thank you.